Hello, I'm Col Phillip Latham, State Air Surgeon for the South Carolina National Guard. And I'm making this video today because I want to address some of the many questions that I'm being asked almost daily by both members of the public as well as those of the National Guard regarding the COVID-19 epidemic that we're encountering this very minute. One of the first questions is the issue of numbers rising so rapidly. Until recently, the testing has been slow to get out, and as testing is ramping up and the tests are becoming quicker and the results are coming back, it is not unexpected that the numbers will rise, and they will rise rapidly in the weeks to come. This should not be a means of panic or alarm to anyone. It should, if anything, galvanize us to the need to address the many factors that the CDC, as well as our governor and the emergency medical folks, are telling us we should be doing. These are real and should be accomplished, such as limiting your public group size, constant social distancing of 6 feet or more when out in public, avoid touching your face, washing your hands, 20 seconds minimum in warm soapy water, and if you can't do that, hand sanitizer. It's very important. And we should also clean all the surfaces in our environment, especially if you're sharing places in your office with friends or family. That's very important. There's going to be some links in the description below to give you some detailed information on how to do that. So please look at those for details. But one of the most important things, if you don't hear anything in this video, is if you are sick, please stay home. Especially for minor illnesses. If you go out in public just to seek out a test or to get seen when you're not really that sick, you're just exposing others as well as healthcare workers and using up vital supplies in that effort, such as personal protective equipment that we're currently very short on. But if you feel ill, contact your doctor, get their best steps and advice, and certainly if you feel very concerned, they will certainly guide you as to where to go next. Also, let your work supervisors know if you're sick and any testing that's applicable so that we can help protect your fellow co-workers. Now, the testing is out there. It's going to become easier to get, and positive or negative these results, they won't change your care if you have a minor illness. So if, again, reemphasizing, if you are sick, please stay home and let those know what's going on with you. Now, comparisons of COVID-19 to the flu are unavoidable. Regular influenza kills 23,000 Americans every year, and compared to the current COVID numbers, that's certainly much larger. But this is not to belittle the COVID issue or the seriousness of this. Much more infectious and much more devastating, especially in certain groups, infection. It should be galvanized because both of these diseases are spread the same way, respiratory droplets. We really must do our best to control those with the measures we talked about earlier, because that is so important. Now, history has taught us some lessons to why that is an important thing. Back in 1918, the Spanish flu was brought back by our folks coming back from World War I. In St. Louis, they basically, in Philadelphia, they decided, despite the fact that flu cases were coming in, to hold a parade that held 200,000 people within 3 days. All their hospital beds were full, and over 4,500 people died in that city alone. Whereas St. Louis, and to contrast it, saw the signs of flu, and in that respect, shut down playgrounds, shut down churches, limited public gatherings, and they had an 8-fold decrease in the death rate in that group. So this is a proven effectiveness even in the less developed medical times we had before. But I want everyone to rest assured, even though I'm giving these alarming statistics and things you need to do, the governor, the South Carolina Emergency Management Division, and those of us in the National Guard are monitoring this situation 24 hours a day, 7 days a week, and working hard to protect you and to protect the fellow South Carolinians. And we will succeed. I mean, this issue has been described as a Katrina-style event nationwide, and that is true. Whereas Katrina hit us hard and fast and knocked down the people of New Orleans and the Gulf Coast, they resoundingly responded and are now standing stronger than ever. We in South Carolina can do the same with this event. Success, however, relies on the persistence and the resilience of all of us to do the right thing, follow the governor's direction, and prevent the spread of this virus. We need to flatten the curve, a lot like St. Louis did. I have complete faith in the great people of South Carolina and that we will succeed in this endeavor.